Okay, I would like to start out by telling you a story, and this story is about Gina. Gina was a physician, and by all accounts, a remarkable physician with a very busy clinical practice. Now, like most women Gina's age, she went in for a normal mammogram. Unfortunately for Gina, she was diagnosed with breast cancer, but she was at a state-of-the-art, evidence-based treatment center, comprehensive cancer center, and after receiving her surgery, her chemotherapy, her radiation, and being started on anti-hormonal therapy, most people would believe that Gina's breast cancer story was completed. Unfortunately for Gina, she still had significant lingering symptoms. Specifically, she talked to us about her cognitive concerns. She started noticing these concerns during her chemotherapy. She just chalked that up for stress and some of the other symptoms that she was occurring at that time. However, by the time she had completed all of her adjuvant therapy and she had proverbially rang the bell for the completion of her treatment, she was still having significant cognitive concerns. She talked about the fact that she couldn't concentrate. She couldn't remember things. She was having such difficulty with her memory. She also talked about the fact that she was having difficulty processing information, or what was called speed of processing, and making decisions. That was very difficult for her. And because of these symptoms, she had to make the difficult decision to not go back to her clinical practice. She relayed to me that she no longer felt confident in her ability to practice medicine. And this was incredibly devastating for Gina. As a nurse scientist, I wanted to understand more. What are our cancer patients going through? What are these cognitive concerns, and why are they occurring, and how may we treat some of these concerns? Now, we all know that breast cancer is a significant healthcare problem, especially for women. It's the second leading cause of cancer among women. We've all participated in the Susan G. Komen Race for the Cure. We have family and friends that have had breast cancer. In fact, there are over 4 million breast cancer survivors in the United States alone. What we didn't know was that Gina was not unique. In my research and looking at this symptom, we have identified that up to 75% of breast cancer survivors will report some cognitive concerns during their treatment and afterwards. So in my research, I wanted to understand this even more. We did qualitative interviewing to understand more about what the symptoms were and why they were occurring. We also did objective cognitive performance tests to measure their cognitive performance. And what we found in those assessments is that patients really did have deficits in relationship to their memory, their speed of processing, and their executive function or decision making. So for those patients with these cognitive concerns, then in my research I wanted to understand how did it affect their everyday life. So we did a series of studies in relationship to its impact on their quality of life. And what we found, much like with Gina, we found concerns in relationship to returning to work productivity, and the ability to work. All of these things are signs of recovery and should go back to what it had been prior. However, for these patients with cognitive concerns, they had significant problems in their work and being productive. We also demonstrated that there are impact on social relationships, and that's when we met Carla. Carla's a 51-year-old housewife and mother. In my interviews with Carla, she talked about how she was self-isolating. She didn't want to put herself into situations where she would be with other people in bigger crowds. She was concerned that she wouldn't remember names or events. But most importantly, she also relayed how it was affecting her immediate family. Her husband, he was initially annoyed, but then he was coming around and trying to help her and help compensate. But really what affected her, which was incredibly devastating, is when her daughter told her that if you really love me, you would have remembered. And so we know that these patients are having these cognitive concerns that are affecting their everyday life. My research has also shown that those with cognitive deficits have an increase in problems in physical functioning, as well as in older cancer patients, we see an increase in frailty, other morbidities, and some research is even showing it has an increase in mortality in relationship to these patients with cognitive concerns. So as a scientist, I really wanted to know, why is this happening? Why is this happening for certain patients? And what we started looking at in my research is, much like what Gina identified, was stress an issue? So we looked at perceived stress as well as the stress hormone cortisol. And what we found is that patients with these cognitive concerns and these other symptoms actually had higher levels of cortisol. We also identified they had higher levels of pro-inflammatory cytokines. There is also other research out there that these patients have an increase in oxidative stress as well as decreased telomere length. All of the things that we see in advanced cognitive aging. On top of that, we now know that chemotherapy can directly impact the brain. We now know that there are certain chemotherapies that can pass through that blood-brain barrier, creating a direct effect on the brain. On top of that, for patients like Gina and Carla, who are started on anti-hormonal therapy, that hormonal therapy will drop out estrogen. And there's research to show that estrogen is related to memory performance, and the lower levels of estrogen will result in concerns in relationship to memory performance. We also know that when you drop out this estrogen, patients will have increase in other symptoms, other menopausal symptoms, sleep disturbances. All of those other symptoms can indirectly then affect cognitive function. And all of this comes together in a perfect storm to create the cognitive concerns that our patients are demonstrating. As you can see from the slide, you can see how hard the brain has to work just to process the information. As a nurse clinician and nurse scientist, I really wanted to look at what could we do to help our patients. And what we decided to look at is using a cognitive rehabilitative approach. Much like you see in a physical rehabilitative approach where you exercise and can improve physical functioning, we were wondering if you could exercise the brain and improve cognitive functioning. So in our team, we started looking at cognitive training as a potential option for patients with these cognitive concerns. The computerized cognitive training program that we are using was developed by neuropsychologists. It's based on the theory of neuroplasticity, or the ability of the brain to form these new neural networks, and it had never been used in cancer survivors. So we wanted to test and see if this would be a program that could help our patients. The unique thing about this cognitive training program is that it has been gamified, and there are modules that the participant can go through. And hopefully with this approach, it's enjoyable, and the participant will continue to use this program. The other unique thing about this program is that it is individualized. You can see on the slide that as you go through the program, it gets more and more difficult. So it will adjust to the person's performance. So hopefully it will be challenging, but not overwhelming. Now this program, as I mentioned, had been used, but it had never been used with cancer survivors. And so it was very important that we start looking at whether or not breast cancer survivors would use the program. So in a series of studies from our lab, we had patients trial the program, and with this program, we were able then to demonstrate that it was feasible to use. We were able to deliver it across the web. Breast cancer survivors were satisfied in using it And what we started to see is that they started to report a decrease in their self-reported cognitive function concerns, like memory or speed of processing. We were also able to demonstrate that there was improvement in memory and speed of processing. This work then became the foundation for our latest trial, which is the largest national randomized clinical trial to date to test cognitive training in breast cancer survivors. This trial is actually funded by the National Cancer Institute, and it's being led right here at OSU. The unique thing about the trial is we're leveraging the community oncology research program sites. This program sites are usually reserved for the drug trials or new therapeutic trials to be dispersed across the nation. This is one of the first cancer survivorship trials to be delivered in this manner. So this is really unique, and we're excited about the fact that we are now distributing this program across the nation. We have over 620 sites that are approved to deliver this program, and that means that we're able to reach people out in the community and rural sites to really fully test this cognitive training program. And our goal is to see whether or not this program will not only improve their self-reported cognitive concerns, but also to test and see whether it'll improve their cognitive performance, and most importantly to our cancer survivors, whether it will improve their everyday functioning, such as workability, physical functioning, and quality of life. The goal of our research has to be starting to focus in on cancer survivorship and managing these symptoms past the original treatment. We know with the advances that have been made in cancer treatment that there are so many more cancer survivors out there. We need more research to conduct trials like this to address symptoms that are impactful to our cancer survivors, so that when people like Gina, Carla, or even my niece here, Jennifer, pictured here, once they ring the bell, we have the evidence-based care to provide for them to improve their symptoms and improve their overall quality of life.